This is the Less Insurance Dependence podcast show with my good friend Gary Takacs and myself, Naren Arulrajah.
We appreciate your listenership, your time, and most of all, we appreciate your intention to reduce insurance dependence in your practice. Our goal is to provide information that will help you successfully reduce insurance dependence and convert your practice into a thriving and profitable dental practice that provides you with personal, professional, and financial satisfaction.
Hello, everyone. Welcome to the Less Insurance Dependence podcast, the official podcast of the Reducing Insurance Dependence Academy, www.rid.academy. Membership to the Academy is a gift from Gary and I in appreciation for your listenership. Visit rid.academy and don't forget to register. By registering, you will have access to all of our resources and a free pass to all of our events, including our annual summit. I'm Naren, your co-host. Today's podcast is titled Recession Proofing Your Dental Practice. But before we jump into today's topic, I have an announcement. Thriving Dentist Live Workshop is happening in Austin, Texas. We have not had one for like 5 years. This is the very first one we are doing since COVID. And it's on 1st of February, 9 to 5 p.m. Saturday. The city is Austin, and the link is thrivingdentist.com/Austin. And the goal of this 1 day, 8 CE event is to do two things. One is to help you create or achieve work-life balance. The other one is to give you the blueprint to create a thriving practice. You're going to drink from a fire hose. We're so confident this is going to be the best event you ever had. If you are not happy, send us an email, go to thrivingdentist.com and contact us after attending the full event, and we'll refund your money. We are that confident this is going to be just mind-blowing. How do we know this? Because the last event was just spectacular, and people like literally were writing to us saying, please bring it back. Gary, any comments?
Well, I'm excited about this live workshop coming up in Austin on February 1st. Excited about the combination of two very important topics we'll cover: how to develop a thriving practice, one that provides personal, professional, and financial satisfaction, and at the same time, achieving an effective work-life balance. Very excited to share the blueprint that you can take back and apply in your practice regarding both of those outcomes. And if you're sitting there thinking, Gary, aren't those mutually exclusive? I could have one, but not the other. No. You can actually have both of those. You can have a world-class practice and an effective work-life balance. And I'll unlock those secrets for you at that workshop. Come join us. 8 hours, I'll be your speaker. The room will be filled with other like-minded colleagues. Always cool to hang out with like-minded colleagues in dentistry. Great location, Austin, Texas. If you've been to Austin, come early, stay late. If you've never been to Austin, we're giving you an excuse to visit Austin and come early and stay late. We've got some very attractive early bird tuition specials right now. Go to thrivingdentist.com/Austin and take advantage of those early bird tuition specials. Tuition will never be less expensive than it is right now. Look forward to seeing you in Austin.
Thank you, Gary. The topic is recession proofing your dental practice. And like many of you know, I'm a serial entrepreneur. I run Equa Marketing. And one of the ways I think about business is I look at what's the worst case. And I try to make sure that even in that situation, I can thrive. Because if you can do well in the worst case, you're going to crush it when things are awesome, right? Recession proofing your dental practice is that same mindset. How do you create a practice that even in a recession thrives, right? Because if you're thriving in a recession, you're going to thrive in great days as well. I know many of you feel like we are in a recession because your costs have gone up 50% in some cases, like wages. But is your income up or revenue up 50%? Absolutely not, right? Insurance companies are paying you less, and patients are not easy to come by or easy to please because they are getting squeezed too with high inflation and and interest rates being high. So, Gary, what are your thoughts?
Well, I mean, let's face it, doctors. The tide ebbs and flows. Think about the tide ebbing and flowing, and at different times in your career, you are bound to face headwinds, in the economy. It's going to happen. Economies go up and down, and you'll face headwinds. How do you set up your practice so that in the face of those headwinds, you still thrive? And the simple answer to that, the answer is simple, but the execution of it is complicated. The simple explanation is you give patients reasons to value your office and to come to your office. You give them reasons, right? Does it mean you give people what it is that they want?
Right.
And what could that be? I mean, let's explore that for just a minute. What could that be? It could be in dentistry. It could be that you're so well trusted in the community that people choose you because of their trust. They know that if they go to your office, doctor would never recommend anything, or doctors, if there's multiple, would never recommend anything that wasn't in your best interest. And you know what's interesting today? Today, we actually have barometers to measure trust in the practice, Naren. In the past, it used to be sort of abstract, right? Like, how do you measure trust? But today, if you've got many favorable Google reviews that talk about how much they trust your office, there's now a barometer out there for the public to measure trust, right? Let me take it a different direction. It could be that you have state-of-the-art technology in the practice. Naren, you're a nerd. I'm a nerd. I use that term. It's meant to be a compliment, not a slight. But are there people in the world that would choose a dental office based on having state-of-the-art technology?
Absolutely, 100%.
Yeah. In fact, there'd be some that are seeking that out. What might be some other ways that we give people reasons to visit your practice? What would be some other ways? You know this because you're in the marketing world.
I think let me talk personally, right? So one of the reasons I go to a dentist is I believe they care about me. I believe they take an interest in my health, right? I believe not only because they say that, because they live it. They do certain things that shows me they are really actively monitoring my health and being on top of it. They educate me. The other thing I go to a dentist for is they have a relationship with me. They know me. I know them, right? They treat me like family. Like they remember the important things in my life. They inquire about those things,
Well,
about
let me
my daughter
amplify.
and
Let
so
me
forth.
amplify that last point, Naren, because
Yeah.
you're absolutely right. That having a relationship-driven practice gives people a reason to come to you. I mean, let's face it, dentistry is a very personal service.
Yeah.
It's the nerve endings, the sensations in your mouth. It's a very personal service. And many people want to go to a dental office where they're taken care of by people who they know, like, and trust.
Right.
So the simple answer to recession proofing your practice is give patients lots of reasons to come to you. Another one might be that it's a preventive oriented practice. In other words, they help you prevent future problems, right? Is prevention a term that when it comes to healthcare, do you think people might be dialed into preventing future problems? You bet.
100%. Yeah.
Early detection, all those kind of things. So the simple answer is give people lots of reasons to come to you. Now let's take it to contrast that. Let's take the discussion another direction. The truth is you can get good patients from any of the dental PPO plans. You can get good patients from Delta, from Travelers, from Blue Cross Blue Shield, from Aetna, from MetLife. Is that a true statement? In other words, what I mean by you can get a patient from them, they went to the Delta website and they looked up the provider list and they chose a dentist off of that provider list. Can
That
you
is
get a good
correct.
patient that way?
You can definitely get a good patient, but one thing that I'm noticing is, like, I was talking to Ben and he's actually doing a study on this, and he said
That's
5% of the
Ben Tune.
Ben Tune, yeah. And he said 5% of the people are actually going to the Delta website or the PPO website. Instead, what they're doing today is, even though, that's what they're doing is they just go to Google and they look at they Google what they want, they find a good website, and then they look at your reviews and they're calling your office and then they say, hey, do you take Delta? So in other words, they don't even know that you take Delta because they never went to the Delta website in the first place.
Well, can you get a good patient that way though?
Yes, you can. Yes,
Yeah,
because they're going to go into the Google and checking you out anyways. I mean, the only
but
reason they're coming to
many,
you. Yeah.
but many of them come with baggage.
Yes.
And the baggage they come with is they're only interested in going to your office if you're in network with their insurance company. Correct?
Right. Right. I mean, I agree. I think that is correct, but also it depends on how the phone your team member is trained, because sometimes the team member just plays into it, right? So I mean, if you can retrain them to say, hey, they're asking the only question they know how to ask, which is, do you take my insurance? They don't even know the terms of in network and out of network and all that stuff,
Right.
because sometimes even when the patient is not keen on whether you're in network or out of network, the team members answering the call could like drive them into that ditch.
Yeah, the insurance, it's a slippery slope
Yeah.
with insurance. But many times patients that come to us because you're in their network, that's a reason to come with. Then let's face it, insurance companies are all about commoditizing dentistry.
Right. Right.
It's a commodity to the insurance company. They want the public to think that a crown is a crown is a crown, doesn't matter where you go.
Right.
How can I prove that? It's the same fee for all their members.
Mm-hmm.
They pay you the same thing. They don't care. They don't ask you. They don't send an auditing team out to your practice ahead of time to say, wait a minute, you have thousands of hours of CE. You have an
Right.
amazing team that you're paying the top of the wage scale. You have state of the art technology. So we're going to give you better fees.
Yeah, they don't.
No, it's a commodity. Crown is a crown is a crown, and dentist is a dentist is a dentist. They're in the business of commoditizing you. Um, and businesses that are a commodity will suffer more in a recession.
Exactly.
Businesses
I think.
that are desired, there'll always be people that desire that. Um, and the key is to attracting people that really value what you do. The truth is, a Delta patient could value you. They could over time uh, value, but somewhere not far from the surface is that driving, overriding thought that I only want to go where my insurance pays for it. And there's another way to say I only want to go if it's free. you know, uh, and that is not necessarily uh, the type of qualitative analysis we want done by the patients. We want patients coming to you because they really value what it is. So one of the best ways, and this will sound contraindicating, but one of the best things you can do to recession-proof your practice is to successfully resign from PPO plans. Think about that, Naren. It sounds contrary, doesn't it?
Yeah, it does. I think it's also the mindset, right? Because sometimes if you are let's say 80-90% of your patients are PPO patients, you kind of give up and you just start acting like, anyways, they're coming to you because you're free. So why do I care? Or why do I need to have a relationship with them? Why do I need to invest in my people? Why do I need to invest in technology? You don't have the money to do it. So obviously that's a huge reason why you don't do it. And the second reason is you just give up because they see you as a commodity and you start seeing yourself as a commodity. But imagine if you're saying, you know what, it's my life. I can do anything I want. Let me start by dropping one plan and start catering to the customers who are not on PPO plans and giving them a reason to come to me, right? Whatever that reason is, whether it's relationships, whether it's your passion for a certain kind of service you provide, or whether it's your passion for health, whatever it is, or education, like, you can start create. I mean, I think most people, if you were to ask most dentists, they didn't go to dental school to, be a commodity. They went to dental school to change lives. You know what I mean? So they don't want to be like the
Yeah.
least common denominator. They wanted to be something to somebody.
And exceptional.
Yeah.
Wanted to do something that allows them to stand out in the mind and eyes of their patients. Uh, and I'll tell you that successfully resigning from PPO plans is not right for every practice.
Yeah.
It's not. If you have a commodity-based practice, don't do this. If the patient can go, a quarter mile down the street to a corporate dental office and get the same thing they get in your practice, then that's going to be a tough lift for you to do. But if you're
Right.
providing, I think we've gotten to know our less insurance dependence listeners, and They certainly represent a wide cross section of our profession, but I think a common denominator is they're deeply committed to their practice and to their patients, and they're doing exceptional things. If you're doing that, then you certainly have a pathway to successfully resign from PPO plans, and in turn, position yourself for when you meet the headwinds, because no matter what, the people are going to seek you out. Not all businesses suffer in a recession. You look at other business segments, there are segments that always thrive regardless of the economy because they're providing something that the consumers want.
Yeah, I mean, I think of
providing something.
Apple, right? They sell an expensive product, but doesn't matter whether the economy is going down or up or sideways, they do well.
You still want it.
Yeah, people want it.
You still want it. And the nice thing is, and something for you to think about is, I would never suggest that any of our listeners treat the idea of resigning from a PPO plan casually. That's a mistake.
Yeah.
Don't do that. Don't do that. But I'd like to share something I don't think I've talked much about throughout our 300 plus episodes, but you do have a backup plan if it doesn't work.
Yeah, you can go back.
Sign back up.
Yeah.
Right.
So I think
you
the key point.
Well, let's explore that.
Yeah.
Resign from MetLife.
Right.
And let's say you miscalculated and there's a stampede out the door and everyone left. What could you do?
You can go back.
Sign back up. Will MetLife accept you back? You bet they will.
100%.
Now,
yeah.
I never, by the way, we've never had anyone have to do that in our coaching. Over 400 practices in all 50 states. But it's kind of nice to know, it's just like if you're a skydiver and you've had, 2,000 jumps, every time you've worn a backup parachute, but you've never had to use it. That's pretty good, right?
Yeah.
So you have a backup parachute. The backup parachute is you sign back up. Think about that. And how does that change how you think about your next steps?
I think it totally changed. And I think it totally changes who you are and how you're being. I think for me, it's not whether the key is not resigning or not resigning. The key is, are you going to be an insurance dependent practice or are you going to be an insurance independent practice, right?
I might even broaden it. Yeah. Are you on a journey to have your practice be the best reflection of who you and your team members are? Are you on that journey?
Exactly. Yeah.
And if you're on that journey, does that match up with the insurance company trying to commoditize what you do?
No, absolutely not.
Why would you do something that is diametrically opposed to your end result?
Your self-interest. It kind of works against your self-interest. Because it works against your team because they have to work twice as hard and paid half as much, right? It works against your professional satisfaction because you can't do what you want to do and give the time you need to give your patients. I mean, it sucks away the joy of life and, healthcare.
Hopefully we've given you some things to think about. Recession-proofing your practice. One of the best ways to recession-proof your practice is to give people a great reason to come visit your practice, but that also is your key to successfully resigning from PPO plans because now you've given people reasons to choose you. So they go hand in hand. Well, I hope you've enjoyed this stimulating discussion. Learn some things, can apply some things. If you'd like to learn more about whether your office is in a position to be able to do this, set up a coaching strategy meeting with me. Go to lessinsurancedependence.com. Actually, no, we go to thrivingdentist.com/CSM. We have different links. I want to make sure you get the right one. Go to thrivingdentist.com/CSM. And if you'd like to do something to learn how to attract patients for reasons other than being on their insurance plan, I would encourage you to set up a marketing strategy meeting with Equa. Naren, what's that website?
Yeah, the link is equa.com. That is ekwa.com/M for mass marketing, S for strategy, and M for meeting. So equa.com/MSM. We spend hours researching how you are doing versus your competition, give you a report card. Plus, we'll give you a 12-month blueprint to dominate Google and attract all those patients from Google and not from your PPO plan. And it's a $900 gift from us, and take advantage of it.
Yeah. Well, on that note, thank you all for the privilege of your time. Naren and I look forward to connect with you on the next Less Insurance Dependence podcast.